Hi, I'm Lynn Doyle, and welcome to Health Awareness. You know, it's all about your brain, and that's what we're going to talk about today. I have as my special guest Dr. Natarajan from Memphis Neurology, and we thank you so much for being here. We're looking forward to hearing about everything, because when you or I were talking earlier, oh my goodness, you all just treat everything over there.
Pretty much.
So I want to start by saying, what are some of the things that you treat? We talked earlier a little bit about epilepsy. We talked about something interesting with Botox. I want to talk about all those things, but let's start with epilepsy.
You know, our practice has several neurologists,
Okay.
and I'm one of them. And my special interest has been in epilepsy since the time that I did my training in neurology. And epilepsy is one field that affects a significant amount of people in America. And somehow, in spite of so many advances that have happened with new medications and new technologies to diagnose and treat, we still have a lot of patients who are intractable, as we call them in the medical world. These are patients who do not respond to the current treatment options, including surgery. So it's a pretty challenging field, because no two patients are similar. They may have the same type of seizures. Both of them may carry the same diagnosis. They may even end up being on the same medicine, yet they are so different from each other in the way they behave and the way the seizures respond. So it's a very challenging field, and it's more challenging for me personally because I treat both children and adults.
Wow.
And I take care of patients when they start having seizures when they're children. And then in the last 12 years that I've been in Memphis, I've had the opportunity to see some of them growing into young adults.
Wow.
And being successful in their own fields. So that's very comforting and rewarding.
Managing their treatment from the time they were a child.
That is right.
On through their young adulthood.
That is right. So I've seen some, 8-year-old, 9-year-olds, and 12 years later, now they're in the workforce and working, and maybe someday you see them somewhere and say, hey, you took care of my seizures, and now I'm doing this and this. So I think, like most of neurology, epilepsy is one field. It's a subspecialty in neurology. There are doctors or neurologists who just treat epilepsy patients, and that's what they do. And it's very rewarding. It's a very challenging subspecialty because of the volume of patients that are stricken with this disorder, and also in sometimes the difficulty in getting them under control.
Is there something that causes epilepsy? Are there different things that cause epilepsy?
Basically, there are two types of epilepsy. If you look at it from the cause factor, then there are patients who have a reason to have seizures, or epilepsy, which is seizure disorder, by the way.
Right.
So these are patients who have an underlying cause. So, for example, if somebody has a tumor in the brain, in certain parts of the brain, that can trigger seizures.
Okay.
There are patients who may have an abnormal tissue in the brain. This is a tissue that formed while the brain was being formed. So this is something they were born with.
Wow, it's a genetic kind of
Genetic,
thing.
that's right. And you can have a situation of a bleed or trauma. Trauma is a very significant factor in causing seizures.
Okay.
And of course, stroke in the elderly can cause seizures. So there are several reasons why people can have seizures over a long period of time. Then you've got those patients who have seizures over a short period of time. For example, somebody has very low sodium levels. You see this a lot in nursing home patients. The serum sodium level falls below a critical value, below say 126 or so. If it falls below a critical value, then they start having seizures. But those seizures stop the moment you correct the sodium. They don't turn out to be epileptic patients.
Okay.
Then you've got those patients who are having seizures because they are exposed to certain kind of medications. And once you stop the medicines, the seizures stop.
Okay.
Then you've got patients who've got withdrawal from alcohol, or they have
Yes.
drunk too much in alcohol-induced seizures or withdrawal seizures, which we see a lot in our emergency room. And of course, patients who have a low seizure threshold to begin with, and then they put themselves in situations where they're either smoking marijuana or
Yes.
doing the wrong things in life, and that causes seizures.
Wow.
And apart from this, there's a huge chunk of patients who have what we call genetic or idiopathic seizures, where you really don't know what is causing the seizures. You can do every test that's available to us, and all of them come back normal.
Wow.
Or near normal, and these are patients who have got, the old terminology was idiopathic or unknown, and we now call it genetic seizures. So there is a genetic predisposition to having seizures.
So it could be for a lot of reasons, but the bottom line is they would need to come to you for some kind of treatment to try to get that under control, because seizures can do some damage, can they not?
Absolutely. Seizures can be damaging. Repeated seizures can be damaging to anybody, because it does affect the electrical activity of the brain, and the brain works on electrical pathways and chemical pathways. So repeated seizures in the long term in certain areas of the brain can be damaging, especially to memory and things like that.
Sure.
Then you've got conditions where the seizure starts and it doesn't stop. And if it goes beyond a certain time period, it can cause irreversible damage to the brain.
Wow.
So it's really important that people understand that. Then, of course, the main question is this a seizure?
Yes,
Right. Because I see a lot of patients who come to me and they say, my son had a seizure. And I tell them, I said, don't use the word seizure till we prove that this is a seizure. Because it may have looked like a seizure, and it's not a seizure. And sometimes things don't look like a seizure. I may be talking to you, and while I'm talking to you, I may just stop for a few seconds, and you may think I'm taking a break, but actually I may be having a seizure.
Really? So it's not, we've been traditionally taught just as the lay people, just as a public, that people fall down on the ground and they shake and they might hit their head, and truly that might happen with some, but what you're saying is it can be way more subtle than that.
Absolutely. It's interesting you bring this up, because we have this in the hospital situation all the time. Even the trained nursing staff who've been nurses for 20 years sometimes make that mistake, where they see a patient having all those jerking movements that you were describing earlier, and they will call us and say the patient is having seizures, and sometimes we have to go there and see it. And once we see it, then we make the decision on the basis of our knowledge whether this is a true seizure or it's not a true seizure.
Right.
And it's very important to understand that just because you fall to the ground and you roll your eyes up and you start shaking doesn't mean that you're having seizures.
Wow.
There could be other things that could mimic a seizure, and to the point where you will lose control of the bladder.
Yes.
Okay? Losing control of the bowel is, not normally seen unless until it's a true seizure, majority of the time. But again, you could have a spell without anybody around you noticing that you're having a spell. Especially in children, they have something called absence seizures or peri-mal seizures, and they are in school, and as a parent, you wonder why your child is not making good grades, and the teachers sometimes say, your child is daydreaming or not paying attention.
Wow.
Somebody says, oh, that's ADD or attention deficit disorder. And in fact, when we do more workup on these children, it turns out that they're having absence or peri-mal seizures.
Wow. So it could even be confused with an ADD.
Absolutely.
And so that's why when something is happening that's out of the ordinary, don't automatically think it's a behavioral problem. Go get that checked out, because you all treat ADD as well.
Yes. We have physicians in our group who specialize in treating children with learning disability, dyslexia, attention deficit disorder, autism, PDD or pervasive developmental disorder, speech disorder, cerebral palsy. So we have several doctors doing that. But what I'm trying to say here is, if you ever have a child who is not doing well in school, just don't assume on the basis of the psychological testing that, oh, this is ADD, or
Yes.
this is dyslexia, this is processing, audiovisual processing disorder. I think somewhere we have got to look for underlying structural and functional neurological problems that is leading to this issue.
This is so very important because sometimes a little bit of information is dangerous. And I think with as smart as we've gotten and all the technology out there, there's just nothing that takes the place of sitting down with someone like yourself who has studied this for years and saying, this is happening, what do you think? In other words, just don't go to the internet and look up ADD or let somebody say that your child, or if you're an adult, is diagnosed with this. Go to a physician like yourself, a specialist, and find out exactly what it is, because it doesn't really do any good to treat the wrong thing.
Precisely. I think it's very important for the patient or the caregiver to be aware of what the possibilities are and be educated.
Absolutely.
And you know, fortunately, the internet provides that forum where you can Google something and you can get the information, the basic information that you need about a disorder. But any disease, you know, has a spectrum to it.
Sure.
So, for example, headache. You know, you can have a headache because you've got a really bad aneurysm or a brain tumor sitting there that's causing the headache. Or you can have a headache as simple as you are stressed out or you didn't sleep well, or people who have underlying, you know, GI problems with their bowel movement. That can cause headaches. So when you do a search on headaches and all these things pop out, where do you put yourself?
That's right.
You know,
and will you put yourself in the right place?
That is right. And even if you have a diagnosis and you come to know that your headache is because of X disease, that X disease has a huge spectrum again.
Sure.
So I think what a doctor does is customize the care.
Absolutely.
And the internet is giving you a general, you know, it's like buying clothes. And you can go to Macy's or someplace and you can buy clothes, but if you really like to wear good fitting clothes, you're going to need a tailor.
And got to try that on.
And you've got to try that on. So I think
Sure.
from that aspect, the internet is very good. It's good to get the knowledge and the awareness of what's going on, but leave it to the doctor to customize that and give you the answers appropriate to the patient.
Yeah, that's a great way to put it. And headaches, certainly another whole field, but if you are having headaches, it would be good to get that checked out, because headaches can be, as you said, something that's just relative to stress, or it can be something very significant and life-altering, like an aneurysm or something else happening in your brain. So
That is
you
right.
need to get that checked out.
Yes. If any illness or any symptom that is persistent has to be checked out.
Yes.
That would be the right thing to do, because, you know, we all live in a world that is very demanding.
Absolutely.
From our aspect of time. We are pretty much running a rat race from morning till night, all of us, in
Sure.
whatever we do. So there's very little time that we give to ourselves when it comes to illness.